Hi there, my name is Traci Wilke and I'm a physician assistant who's practiced in dermatology for almost 20 years. And August is Psoriasis Awareness Month, so I wanted to spend a couple of minutes giving you some general information about psoriasis. First, it is caused by a combination of both genetics and environmental factors. But I'd say the biggest factor that affects psoriasis is stress. Most of my new psoriasis patients are adults who are dealing with stresses of life, job stresses, marriage stresses, new baby, sleep deprivation stresses, financial stresses, etc. It's also important to know that sometimes poor health can be the stress that triggers psoriasis. So in cases where I have patients that they tell me, life is good, their marriage is good, they like their job, they have money in the bank, and they don't seem to be able to identify anything that's significantly stressful in their life, we dig deeper into potential underlying health conditions, because sometimes a patient might have undiagnosed diabetes or undiagnosed elevated blood pressure, and when we find those underlying causes and treat them, a lot of times the psoriasis goes away, and that is just very rewarding when that happens. I love that. The other thing that I want to emphasize about psoriasis is it's not just a skin disease. We know that psoriasis is an inflammatory condition that's visible on the skin, but it's also causing inflammation of blood vessels. And because of this, patients with psoriasis are at higher risk of cardiovascular disease. And so because psoriasis is not just affecting the skin, I think it's best to choose treatment options that treat not only the skin, but also the internal inflammation that's happening in blood vessels and sometimes also in joints. There are so many new biologic therapies that are quite literally changing the lives of many patients, many psoriasis patients these days, and it's been such a fun few years that over the past 5 years, I'd say there's been so much medical research and so much learning that's happened about the disease, and so many new developed targeted therapy options for patients. So I always kind of tell people there's never been a better time to have psoriasis, because the treatment options are just increasing in efficacy and safety all the time. I just love it. So if you or someone you love has psoriasis, first give them a hug, because they probably are feeling a little bit stressed out. Maybe ask them to go for a walk. It's good for their health and they can talk about their stresses. But also I would encourage you to help them find a local dermatologist or dermatology PA that really enjoys treating psoriasis, because there's so many just great options available. All right, have a great day.